Welcome back to the channel. Rochelle Walensky, the CDC Director, is becoming quite the politician. By that I mean, she's becoming good at lying. She lied to Congress a couple times yesterday. I want to walk you through those, but I want to talk more broadly about her failures of evidence generation, etc., etc. Rochelle Walensky is just, frankly, not a good CDC director. She trivializes harms of vaccines. She has a one-size-fits-all mentality when it comes to vaccine recommendations, but except for the new one, where, of course, now we can focus on 65 and up. So people seem to forget the argument, which was we couldn't have had a tailored guidance for 65 and up because people will be too confused by that guidance. And now they're going to go ahead and issue such guidance showing that the American people are smart enough to know how old they are. It was always ridiculous to have a one-size-fits-all policy. That was on her watch. It was always ridiculous to not take myocarditis seriously in young men. That was on her watch. It was beyond ridiculous to continually push a series of retrospective garbage papers in MMWR and cite that prominently on long COVID, on risks of to the unvaccinated who have had COVID, on children, etc., etc. They did nothing but that. They put the worst quality evidence out there to support their bizarre masking strategy, which is, I think, still in effect. I think they would have you have toddlers still masking for the next 100 years. They've done just a bad job. And the root failure, what is the root failure? I think the root failure is it's somebody who wants to be well-liked and does well in bureaucracies that has this position. And she's also somebody who doesn't really understand evidence-based medicine. That's her root failure. She doesn't understand evidence, she doesn't get evidence, and she'd rather lie to preserve her face than to confront the fact that she has made mistakes and that they could have done a better job. So how did she lie recently to Congress? Well, she was confronted by the question, said, Dr. Walensky, back in 2021, you told us, quote, vaccinated people do not carry the virus, they do not get sick, end quote. Was that accurate? She says, quote, at the time, it was accurate, she replied confidently. She said, we've had an evolution in the science and an evolution of the virus. All the data at the time suggested that vaccinated people, even if they got sick, could not transmit the virus. Even if they got sick, what the hell are you talking about? You never had that data. You're just making shit up. And in fact, even when you said it at the time, your CDC staff tried to walk it back in the days since then. You may have forgotten that. And there are other people who said misleading things, like Fauci said that vaccinated people become a dead end to the virus. That was also false and misleading. How did they really get it wrong? We were in the midst of a global calamity in 2020. People were voluntarily and by force of law staying in their houses, sheltering in place, not going to work. Schools were closed by the force of law, destroying the livelihood of a generation of children, even though children were not at high risk in any way, shape, or form. It was always on par with seasonal influenza for children. They could have easily gone to school. There was no evidence that closing schools actually decreased transmission in the community. All these factors showed that that was a pretty boneheaded decision and has robbed a generation of their future. But it was a tumultuous time. And during this time, we were developing the vaccine under Operation Warp Speed, which was a success, actually. I don't think people realize that. And Operation Warp Speed, at a time of great crisis, streamlined a lot of aspects of vaccine development. But one aspect of vaccine development that they could have done a better job is the evidence generation part on the tail end. What do I mean by that? The original trials of Pfizer and Moderna did not routinely swab contacts of people who were in those studies. Okay, in the Moderna, let me explain what I mean. You're in this randomized control trial. You've agreed to participate. They're asking you for all sorts of things, from blood, from information about yourself, to report any symptoms of COVID-19, to use the swabs that they provide to you, to mail those in so that they can test to see if the vaccine is effective. You're doing a whole lot. I mean, you're a participant in a randomized study in a pivotal time, at a time of national crisis. You're either in the placebo arm or you're in the intervention arm. It wouldn't be that much to ask you to do just a little bit more that might give us some useful information. What might that be? One might be every week or every 2 days or every day, you just swab yourself and we just store those samples. And then later, we randomly go, pick a bunch of samples and run PCR testing to see do you have the virus. They actually did do that in a subgroup of the Moderna study. They found a 60% efficacy in lowering the rate of virus in your nose. But that's not exactly the question of transmission. That's what I think people forget. Could you be vaccinated, have a lower risk of getting sick with COVID-19, lower risk of severe disease, but nonetheless spread the virus as freely as anyone else? Or did your risk of spreading the virus go down as well? Now, how might you get at that question? That's a question of whether or not you can give it to someone at such a level that they actually get sick from it, not exactly swabbing yourself and looking at PCR. It's actually, do they get it? And there's a simple solution to that, which is that when you run the randomized controlled trial, the people who live in your house may also participate. You may randomly assign people kits to give to their family members, to swab the family routinely. Or you could survey the family and see how many family members got sick with COVID-19 to show not only do we reduce COVID-19 in the people we've either vaccinated versus those that are in placebo, there's also a reduction in the cumulative number of cases in households, in those households where at least one person received vaccination. You could easily do such a study. Why might you do such a study like that? Well, you might choose to do it that way because you're spending trillions of dollars. You're spending trillions of dollars. The world is in crisis. Everything is gummed up. Society is not functioning the way it normally functions. You might think this is a great opportunity to actually do some things right, to collect good information. In fact, you could go beyond that. There are a lot of ways you could have improved those studies. You could have had a large randomized controlled trial with different cohorts. In the elderly, the primary endpoint of the study might have been overall survival in nursing home patients, just to prove that not only do you get less virus, you actually have a reduction in hospitalization or death, or maybe there's an even overall survival benefit, and you could even run that in nursing homes. I mean, that could have a really hard endpoint. In younger populations, you could actually even run the study a little bit longer. You could have made hospitalization be the primary endpoint of the study, not just symptomatic SARS-CoV-2. And in very younger populations, presumably because the risks are lower, you could run it even longer to get a little bit more information. And you certainly could look at close contacts. These are all things you could do. You don't need one study. You don't need one randomized trial. You could have multiple randomized trials of each product. You could have ongoing randomized trials where you're testing different doses and different dosing strategy. You remember Pfizer was Q21 days. Every 21 days you got first dose, second dose. Moderna was 28 days. Those were arbitrarily chosen to get a quick readout on this study. You could have made it 21 days but had an arm that goes to 42 days or 68 days or et cetera, et cetera. And then you would learn a lot. You would have actually solved the safety, one of the crucial problems, the safety signal problem. You would have found that spacing those doses apart, particularly in younger men, would lower the risk of myocarditis. You could have found that. And you might have also found you didn't need the dose you gave them in order to justify a strong protection against severe disease. You may have also figured out 1 versus 2 dose, 2 versus 3 doses. You could have done those studies. Really a platform of studies that you could have embarked on. She didn't do any of that. She didn't advocate for it. She never talked about it. She just assumes that the minimal amount of studies that they've done and the shitty MMWR retrospective mask studies, that's gospel. That's the scientific truth. And that's her Achilles heel. I really don't think she understands the importance of randomized controlled trials. I really don't think she understands why comparing Maricopa County masking to Pima County is not a scientifically valid thing to do. It's crazy. It's got so many confounders. You're never going to get this truth out of it. I don't think she has a track record as somebody who's a great evidence-based medicine proponent pre-COVID-19. She's an ID doctor. People act as if being an ID doctor is some great thing. It's not if you don't understand evidence. Okay, understanding evidence is the most important thing in every branch of medicine and maybe even beyond medicine. And she doesn't understand evidence. So when she went there and said that all the available evidence showed that vaccinated people, they don't carry the virus, that was inaccurate. And what you should have said is that, you know what, Congressman, we could have actually demanded better studies to see if vaccinated people could transmit. We don't have that. We didn't do that. I apologize. It was my predecessor to some degree, more than me. She could say that. She'd throw him under the bus, throw Redfield under the bus. But what we're doing right now is an ongoing study. We know that we can't roll out this vaccine to everyone right away, so we're doing a step wedge design, looking at household contacts as we roll out the vaccine. So Congressperson will be able to answer your question whether or not there's a reduction in spread by swabbing people in the households where one family member got the COVID-19 vaccine. We're working on it, Congressperson. We don't know yet, but we have a study for that. Then the Congressperson says, hey, you know, what's the data for masking 2-year-olds? We're working on that too. We have a cluster randomized trial. Actually, we have several. We have one for under 5. We have a couple for 5 to 7, one in the school setting, one not in school setting. What about healthcare workers? Director Walensky, do healthcare workers need to wear masks? You know what, Congressperson, we actually have multiple cluster randomized control trials testing N95 versus KF94. Maybe since it's a little bit easier on the ears, they're going to wear that better. We don't know the answer. We're running all these studies. She didn't do any of that. She didn't run any studies. This is a time where the government is spending trillions and trillions of dollars. I think 6 trillion direct federal outlays, maybe 20 trillion in incurred costs at a societal level. And she's not spending a nickel on these studies. She controls a massive budget at CDC, a staff of 40,000, perhaps many useless people there too, collecting wages because they're working from home and not doing anything of value and generating low quality evidence. All of that money, all of those resources could have been marshaled for this agenda, a scientific agenda. I believe in peak crisis, they actually brought a boat hospital outside of New York City just in case they were to need it. They didn't need it. That's the kind of resources this country has. And you're telling me you can't run a randomized control trial on any question. And yet you pair that with just extreme arrogance. And I think that's why she's just so terrible. And I think the future people will decide that she's terrible at this job. And recently, the question was raised did Fauci do a good job? The answer is no. I said that I don't think he's an evil person. I continue to believe that I don't think she's evil and I don't think he's evil. Evil in my mind means your intent was actually to harm people. But I think if you take a very incompetent person and put them in a position of authority and their primary goal is to save face and enhance their own position, as many people's goal is, you will get a lot of extremely terrible consequences from that. It doesn't rise to the level of what I consider evil, but it is gross incompetence. Yes, they should be terminated. No, they should never win an award. And no, they should ever have that position of responsibility again. Those should be their punishments. But, would I hold a tribunal and put them in court? No, they're just incompetent in the way many people are incompetent. The person who hired her is also incompetent because it's a political lackey who's trying to find some political loyalist and not somebody who actually understands science. And the culture of science where people aid and abet her, where they praise her, it's also an incompetent culture where they're all just kind of jockeying for their own positions. And it does work well because if you praise her consistently, you might become the Yale School of Public Health dean. You never know. You never know where you'll be. And if you praise Biden, even when he makes mistakes, you might be the White House COVID czar. And from there, who knows what the future may hold. You may be on the board of directors of Pfizer and Moderna someday. We'll see. We'll see where he goes. But the last FDA commish, Scott Gottlieb, is on the board of directors of Pfizer. So you never know. So that was one great lie. The great lie was that she didn't have to say it so confidently. And in fact, I think there was a different argument to make here back in those days. Dr. Walensky, you're saying that people who are vaccinated don't need to wear the mask. You're saying that these mask rules can follow. We're talking about May of 2021. Do vaccinated people spread the virus? You could say, well, we don't know the answer to that question. We're running a cluster randomized trial. But more to your point, sir, more to your point, Congressperson, your question is, do we need to continue masking? What I would say to you is we've actually never justified it based on randomized evidence. We did it because we had nothing else to offer, and many of us were scared, and we flip-flopped on the evidence, and that cost us some trust in the public health. Once people are vaccinated, we've done all that we're going to be able to do in the foreseeable future to lower the risk of bad outcomes. Either we get lucky and the virus dissipates, or the virus continues to spread. But either way, there ain't nothing we can do. And so we say drop masking because there's no theoretical benefit. If this virus will break through the vaccine, it's going to break through. And so even if the mask had some very modest effect, which we don't know, sir, because we never ran the randomized trial, it's not going to change things over the next year or 2 years. So we're just dropping it right away. Moreover, no one has ever proven to us that if I'm somebody who's worried about my health, I can get that vaccine if I haven't yet had COVID, and I might lower my risk of severe disease. But no one has proven that if I force a 20-year-old or force somebody down the street to get theirs, that reduces my chance of getting severe disease. You're asking about transmission. That's a fair question. But my question is, if I compel that third party to get it, am I actually better off in any meaningful metric? And sir, we don't have the answer to that question. And as such, I think mandates would be a premature abuse of public health authority. She could have said that. She never said any of that. Because she's not a very smart person at this job. She's not good. She doesn't understand evidence. She's not thoughtful. She's probably getting a lot of coaching. That little reply that she gave is probably heavily scripted by people, but it's not actually a good reply. Why do they keep her in the administration? Because this is politics. Being good is not a prerequisite to being a good politician. Just going along, being loyal, you will get loyalty back from the boss, and then you can just say bullshit over and over again. And if you're on the good side, the Democrat side, the media won't call you out on it. If you're on the Republican side, they'll call you out on it repeatedly, but they won't if you're on the Democratic side. And that's how Fauci skates away from all his fiascos. Whether or not there was a lab leak, I don't know, but I certainly don't think he's forthcoming with questions. School closure, which he was a proponent of, masking young kids, which he's a proponent of, not running any randomized controlled trials with the entire NIAID budget. That's on his watch. All of these great failures that he has made on his watch, and just terrible. But that wasn't her only lie. She likes to lie to Congress. And her next lie was about the Cochrane Review on physical interventions to slow the spread of respiratory viruses, where she said, quote, I think it is notable that the editor-in-chief of Cochrane actually said the summary of that review was, she retracted the summary of that review and said it was inaccurate, end quote. That's a goddamn lie, okay? She's lying to Congress. Walensky's lying to Congress. We had Tom Jefferson on this show before with Carl Hennigan. We'll have him on again. That's a lie. Nobody made any correction to the document that is the Cochrane Review. The editor-in-chief made a statement that was completely incorrect and contradicted some public statements that Tom Jefferson had made in the press, which were 100% correct, as I detailed in that interview and actually showed you the quotes. But nothing was retracted to the review. The review is unchanged. And so she is lying. By she, I mean Rochelle Walensky, is lying about what happened to the Cochrane Review. And the failure here is that she ran 0 randomized controlled trials. How can you call yourself a scientist, the head of the CDC, and you have never tested the strategy that other nations are not using, certainly not in the same way. They're not going down to 2 years old. There is global equipoise. You don't even understand what that term is because she's previously lied about what equipoise is. She just keeps lying. And it's just really, it's not evil. It's just gross incompetence. It's just what happens when you take an incompetent person and put them in this leadership position. The problem is that most of the people you might pick are probably incompetent in these ways. We don't do a good job in medicine of teaching how to appraise evidence, of demanding more evidence when you don't have evidence. We do a great job of generating bluster, acting like you're sure. That's a big part of the implicit medical curriculum. But saying, I don't know the answer, and we are studying it in a appropriately designed, adequately powered cluster randomized trial, that's something we don't teach well enough. We teach people to generate answers, pulling it out of their ass. She's the pro at that. That's why she was the chief of ID at a Harvard hospital, and that's why she got the job. And she's still good at bullshitting because the people in Congress aren't adept and adroit enough to call her out and actually put their finger exactly on why she's being dishonest. So they should have said to her, Dr. Walensky, Cochrane has issued no change to the actual document itself. This is a document that's well consistent with what Cochrane does, and you're saying it doesn't, it was retracted or had some changes made. That's factually untrue. Do you want to retract that statement, or would you rather do it next time? Or you want to double down? So, overall, I think that history will ultimately conclude that although there were errors in 2020, and there were errors under the prior administration, no doubt about that, those errors, I think, predominantly occurred in the months of December, January, and February, when you might have interdicted on this problem. Those, I think, were the key errors of the prior administration, those months. By the time March came, the errors were that they were scared shitless, and then they launched this 15 days to slow the spread. They had no idea where that's going to go. They pulled that out of fear, and they didn't have a real plan. They closed the schools, but then the deeper errors were not made by, I don't think, Trump himself. He actually wanted to reopen the schools, which was right, but it was Fauci who continued to dig into that position. There are so many errors around whether or not we could investigate freely the origin of the virus. Those errors were compounded by the media, who dubbed people who wanted to investigate lab leak as racist, while they said wet market. That's not a racist idea at all. That's what Apoorva Manvi said for the New York Times, the reporter. She tweeted that. That was a problem. Then 2021 rolled out, and the prior administration gifted this administration a great thing, which was the vaccine, but the rollout was bungled in so many ways. Fauci didn't want to spread the 2 doses apart, which now has been completely validated as a strategy that would have saved lives, because more people would have gotten 1 dose, and the first dose has a substantive reduction in severe disease. That would have saved lives. It would have mitigated myocarditis, something that they didn't run any studies to try to mitigate. It would have had great benefits. He didn't do that because he's arrogant and thought he knew the answer. You could have said, again, with the NIAID budget, I don't know the answer, but we will do another randomized control trial of the rollout, or we will do a step wedge designed rollout and try to get some better information on this because I don't really know the answer. Could have had some humility. He didn't. He also never ran, ever in his entire time, a single randomized controlled trial of masking, the single most divisive thing that he himself flip-flopped on in 10 weeks. That's bad. And she's terrible too. She may not have understood the uncertainty. She may have wanted to have simple answers. She may not have really thought through the problem, because the problem of compulsion is not that can somebody who's vaccinated spread. That's not the problem. The problem is that if the vaccinated person is already vaccinated, Does compelling the third party benefit that person? And if so, is that benefit so great it outweighs the autonomy that that person ought to have for their health decisions, which should seldom be outweighed in biomedical ethics? And the answer was always no. No way it could have outweighed that. And also, if you did any sort of back of the envelope numbers, you would find that that number would be so horrific. So the mandates were always just such a bad and unethical medical policy. Unjustified. And the fact that they continued to mandate when they knew it couldn't even stop transmission, that just makes it worse. But it doesn't mean they were justified if it did stop transmission. They were always unjustified. They never had the basis for that. And they certainly never thought about the broader implications. They just don't want to admit any errors. And I think that's why, I've said it before, they should lose your trust. I mean, I now have 0% trust in the CDC. I will never trust them. And I hope someday that there is a president who comes in, and what they do is they completely gut that agency. You probably have to fire lots of people who are useless. And then what you need to do is put a firewall. There should be one agency in charge of statistics. They merely report numbers as accurately as possible. They do not set policy. And then you have a policy recommendation arm that recommends policy. They're firewalled from the stats arm, and maybe a third arm that actually does research on the policy, also firewalled. But the moment one agency generates the policy, then keeps track of the kid deaths, they put all these policies in place to restrict children, and they're also keeping track of the deaths of children, and then they keep getting it wrong and overestimating the deaths of children. What am I to think? They're doing it because they want to justify their failed policy. What am I to think when they come up with the policy and then they do the paper that analyzes whether or not the policy was a success, and then they publish it in their own journal, and it concludes, lo and behold, their policy was a success? What am I to think? The perceived conflict of interest is so great, the agency needs to be cut up into little pieces. The stats agency should have nothing to do with politics. The policy-making agency should have something to do with politics, because policy is, to some degree, values and preferences. It should. But they should be separate. And then the assessment agency should be like CBO. It should be completely separate from the politics of the situation. So Rochelle Walensky, she's lying and lying and lying to Congress. She did a bad job, abysmal job, failed. Her punishment should be for people to know she did a bad job, for that to be covered in the news outlets, for her not to get a lucrative consulting gig when she's done with this, for her to be fired from her job and never have a position of power again. And I would argue she should never be the leader of any health organization ever. And I think that's true not just for her, but for Fauci, for Ja, for many others, for Marks particularly. Marks is, I'm most worried he's going to go to Pfizer soon because the way he's making him rich, but he shouldn't. And he's done nothing but damage. And these people are really not scientists, because it's easy to say you're a scientist, you quote unquote follow the science. The hardest thing to say is that as a real scientist, I didn't know the answer to a question, so I designed a prospective randomized experiment to settle the question. As far as I can see, they never do that. Can anyone give me an example where they've actually said, we don't know the answer? Distancing kids, should it be 6 feet or 10 feet? We don't know the answer, we ran a randomized trial. They didn't. Cohorting in school, we don't know the answer, we ran a randomized trial. They didn't. Masking 2-year-olds, we don't know the answer, we ran a randomized. They didn't. Boosters, they didn't. Dosing, they didn't. They didn't run a single one that I can think of on anything meaningful. They talk to Albert Bourla and they take as gospel whatever he says. They go to those Israel analyses and they take as gospel those analyses when they go along with their preconceived policy notions, retrospective observational, p-hacked kind of studies. Sure, but they don't actually commission controlled experiments, even though the person who's telling you is the person in charge of the federal budget, as in Fauci's case, $6 billion budget. Terrible, just a terrible performance. And much worse from 2021 to the present day than 2020. Because the mistakes in 2020 were in the first quarter, and then by then the die had been cast, and there wasn't a whole lot you could do. Developing the vaccine was the best thing you could do. And lockdowns and all that stuff was unnecessary, likely. It probably didn't have much of a difference over voluntary behavioral change. And the true verdict will actually be decades to come, because you're going to need some good studies. All right, those are my thoughts on this complex issue. Key takeaway points: just didn't do a good job, also lying to Congress, and just not a good scientist, not a real scientist in the sense that I think of it. Tom Jefferson, real scientist. Carl Hennigan, real scientist. Walensky, political hack. All right, if you like this video, you know what to do. Like, subscribe, comment, leave a message below. I'll be back next time.